I've worked at United Healthcare for 8 years now, and I am a CNA. I felt it was unsafe. I was overworked, understaffed, and I had no help at all from the management. The conditions were unbearable. We were not given the correct equipment in order to work in the conditions that to protect ourselves for the patients who are elderly, as well as going home to our family every night. A lot of these people within the healthcare field who are in nursing homes do not get the help that's needed, and they were left in the dark with the pandemic happening. During the pandemic, everyone was in need, of the PPE equipment to just the moral support and just knowing where our next meal will come or the next check will come. What's needed is education and jobs. We need to put the funds into the healthcare field. That's what's needed. Helping CNAs become nurses and doctors, helping patients with the needed support within the facilities. And just making sure the facilities are safe as well for not only just the worker that's coming in to help, but also to the patient, because some patients, families cannot care for them. They don't have the training nor the time, because they also have to work. So this is why we have nursing homes, in order to fulfill the family's needs. And if we don't have any workers, then, who's going to care for them?
I've been in the health field for 8 years. Staff that quit during the pandemic, I know a lot. I'm pretty sure it's nationwide. And my field is in the nursing home, which it hit real hard, you've seen how many lives it took. So I think a lot of healthcare workers quitting their job for being overworked due to quitting staff members, working long hours, away from their families, and also with the number one risk of coming home with the disease, or the virus, I should say. It has a big influence or effect on the healthcare system as far as trying to see your doctor. It's going to take a long time for you to get an appointment. Not having staff to see you. The doctors that you need have quit. It's just a lot of ways that it affects us here and as well as nationwide. Measurements that can be taken to solve the problem would have to, number one, start with it showing appreciation for those who never quit. This is the time to set the bar. Also ensure safety to workers, make them feel like they care about them and especially their safety.